Good day everyone, I am Megan Alata, a student from the Our Lady of Guatemala University. So today I will be doing a bed bath for the patient. So first, I will be reviewing the chart for any limitations in the physical activity of the patient. Okay, so now I will be bringing all of the necessary equipment that we'll be needing for this procedure. Okay, so now I will perform hand hygiene to prevent any spread of microorganisms. Now I will be identifying the client and explain them the procedure. So what's your full name po and date of birth? Can you check your ID one po for verification? Thank you. So for today po, I will be assisting you to provide you a bed bath po. Is that okay, Siba? So now I will place the patient na po to provide privacy for the patient. So I will be offering bedpan and urinal for the patient if needed. So now I will perform hand hygiene again and put on my gloves. So first, I will remove the linen and the gown of the patient. Side po. Okay. Side po ulit. Stand up po, slowly. I will remove the gown na po. Thank you. Okay, so now I will start the procedure na. Now first, can you please lay down po? I will now place the towel in your chest. Are you comfortable po? So first, I will rinse the towel and I will rinse the towel without any cleanser and I will raise I will rinse the under eye of the patient. Okay. So next, I will rinse the face, neck, and ear of the patient. So next, I will now rinse the arm and armpit of the patient. So now I will rinse the patient's hand. Okay, so now the patient's hands are dry. I will now rinse the chest, abdomen, and lung of the patient. I will lower the sample. Okay. Can you please slowly get this up? Thank you. So now I will rinse the legs and feet of the patient. I will now apply moisturizer on the patient to prevent any dryness of the skin. Okay, so now I will now return the gown and put on the linen bag. So now I will remove my gloves and perform hand hygiene. So now I will ask the patient, "Ma'am, how's the procedure po?"
It's okay.
Are you comfortable naman po?
Yes.
So after the bed bath, I will now proceed to the shampooing of the patient. So now I will perform hand hygiene. And then now I will prepare all of the equipment needed for this procedure. And then I will now review the chart to check if there are any limitations in the physical activity of the patient. Okay, so I will now put on my gloves. So now I will lower the patient's head by removing the pillow. Excuse me lang po, sir. And then now I will put the waterproof linen under the patient's head. Then now I will place the drain container under the patient's head along with the shampoo and conditioner. now I will place the towel on the patient's head para hindi po siya mabasa. Now I will begin the procedure. I will now raise the patient's hair with 43 to 45 degrees Celsius of water, and I will now apply the shampoo. While applying the shampoo, we will massage the hair of the patient slowly and gently. Now I will rinse the hair of the patient. Next, we will apply the conditioner if the patient requests. Sir, do you want some conditioner, Prof?
Yes, please.
Now we will rinse it with water. And then now I will grab the towel and then squeeze the hair with towel. And then now we will dry the hair with hair dryer if necessary. And then we will brush the hair if the patient's hair is dry. Okay, so now we will remove the waterproof linen. Then I will also remove the towel. And then I will now change the gown of the patient with the uniform. Remove the curtains. Then let's place the towel. And then I will now perform an H. And let's remove the gloves. So after shampooing the patient's hair, I will now offer a back massage. So for today po, I will now offer a back massage to promote a relaxation, comfort, and also to circulate your body. Is that okay po ba?
Yes, ma'am.
Okay, so now I will now put on my gloves. Okay, so now I will assess the patient's pain. So do you feel any back pain po?
No po.
Okay. So I will now assess the patient in a comfortable position, preferably in a prone lying position. Can you please lie on? Thank you. So now I will warm the lotion in a warm glass of water. Okay, so I will now remove the gown of the patient. So now I will ask the patient if they like to turn on or off the lights. Do you like to turn on or off the lights, Paul?
Lights on, please.
Okay. So So now I will apply lotion. So we will now start off with effleurage or stroking massaging. Next, we will now friction massaging. Now, for the appointment massaging, now for the kneading, okay, so I will now assist the patient to wear the gown. Hold on na po. Next, I will position the client in a comfortable position. So I will now do evaluation. So how's the back massage was?
It's really nice.
Thank you po. So I will now remove the gloves and perform a hand hygiene. That's all po. Thank you. So after giving the patient a back massage, I will now proceed to the oral hygiene and oral cavity. So I will now prepare all of the equipment needed. So here it is. And now I will perform a hand hygiene and put on my gloves. Okay, so we will now proceed by brushing the teeth on the upper area. Okay, so please open your mouth po. Okay, so we will now okay, thank you. So now, proceed na po tayo sa lower teeth. So now, bumag na po kayo. Thank you. So, now naman, I will offer the floss if the patient can do it naman po, and then, okay. Can you do it po?
Yes. Okay.
Okay. So, now naman, we will offer mouthwash to the patient. So now naman, we will apply the lip balm to the patient. Can you do it po ba? Or ako naman po? Okay. So now we will remove all the equipment. So I will now perform hand hygiene.
Congratulations to me na kami ang Thank you.